Most of us have been there, either as a patient ourselves or know someone who has experienced it firsthand. A loved one, perhaps. You're lying on a narrow hospital bed, waiting for your turn. Lights glaring intensely above, almost blinding. The air sterile, carrying a faint scent of antiseptic. A nurse double-checks your name, date of birth, and allergies, reassures you with a gentle smile and a few kind words, and the anesthetist, calm and collected, starts the countdown to oblivion. You try desperately to focus on a happy memory, a vacation, a loved one's face, but your thoughts blur, becoming hazy and indistinct. The world fades, slowly at first, then all at once. Machines hum a constant rhythmic drone, voices muffle into the background, distant and unintelligible. Your eyelids grow heavy, impossibly heavy, resisting your attempts to keep them open. One last deep breath, a final conscious act, and then nothing. A complete and utter absence of sensation. You've surrendered consciousness completely. Placing your life in their hands, trusting the surgical team to work diligently and precisely, while you're blissfully oblivious to everything. This is the apparent miracle of general anesthesia, a cornerstone of modern medicine, controlled unconsciousness, ensuring pain-free surgery and allowing complex procedures to be performed. But what if something goes wrong? What if, in that seemingly impenetrable void, a flicker of awareness, a spark of consciousness, unexpectedly returns? The idea is chilling, a nightmare scenario for both patient and surgeon. But it's a real, though thankfully rare, phenomenon known as anesthesia awareness. Today, we'll delve into the unsettling reality and explore what happens when the deep, protective sleep of surgery is unexpectedly and terrifyingly interrupted. So what is anesthesia? It's not just sleep, it's a carefully balanced mix of drugs that renders you unconscious, blocks pain, and relaxes your muscles. These drugs act on your central nervous system, silencing nerve signals to your brain. Some target consciousness, others block pain, and muscle relaxants keep you still. The anesthetist is your guardian, monitoring your vital signs and adjusting drugs in real time. This balancing act makes modern surgery possible, from simple procedures to complex transplants. Anesthesia transformed medicine, turning brutal operations into precise science. For nearly every patient, it works exactly as intended. But for a rare few, something unexpected can happen. Now, let's talk about something that, while rare, is a significant concern in the world of surgery and anesthesia. It's the rare but terrifying possibility, a situation no patient wants to imagine themselves in. It's called anesthesia awareness. This isn't just the typical grogginess you might feel after surgery, the kind where you're slowly waking up and piecing things together. Instead, it's the unsettling experience of becoming conscious during the operation itself, while the surgical procedure is actively underway. Patients may hear the voices of the surgical team, the clinking of instruments, feel sensations like pressure or touch, or, in rare and deeply distressing cases, actual pain, all while being completely unable to move or communicate what they're experiencing. It's incredibly rare, estimated to occur in only a tiny fraction of surgeries. But because the potential for psychological trauma is so profound, anesthetists study it closely, constantly refining their techniques and monitoring protocols. Sometimes the experience is subtle, manifesting as just fleeting sounds or vague dreamlike memories. Other times it's a much more explicit and frightening ordeal, leaving a lasting impact on the patient. The use of muscle relaxants, while essential for certain surgical procedures, can inadvertently contribute to this, leaving patients awake but paralyzed, unable to signal for help or communicate their distress. This phenomenon serves as a stark reminder of how mysterious and complex human consciousness remains, even with all our scientific advancements. We can effectively turn it off with carefully administered drugs, but the process isn't always perfect, and individual responses can vary. A thorough understanding of anesthesia awareness not only helps reassure patients before undergoing surgery, but also drives continuous improvements in patient safety protocols and monitoring technologies within the field of anesthesiology. To grasp the impact, let's hear from those who've lived it. One man recalled hearing surgeons talk, then feeling pain, paralyzed, unable to alert anyone. A woman having a cesarean felt tugging and heard voices but couldn't move or speak. For her, the terror was helplessness, not pain. Some remember only sounds, a tool, a song, a phrase, surfacing days later, causing confusion. These experiences can lead to anxiety, nightmares, and fear of hospitals. Patient stories have driven advances in monitoring and technique. They highlight the immense responsibility of anesthetists. The goal isn't to frighten, but to show why vigilance matters. Every story pushes medicine to do better. Why does awareness happen if anesthetists are so skilled? Often it's not a mistake. Some surgeries require lighter anesthesia for safety, like trauma or cesarean sections. Heart surgery and certain patient factors, like high drug tolerance or substance use, can complicate dosing. Rarely, equipment malfunctions play a role, which is why checks are rigorous. Anesthesia awareness is rare, about 1-2 cases per 1,000 surgeries. The most traumatic form, with pain, is even rarer. For 99.9% of patients, anesthesia works perfectly. Understanding the causes helps teams identify risks and take extra precautions. The risk is never zero, but it's extremely low. What does anesthesia awareness feel like? Most report hearing sounds, voices, machines, instruments, sometimes muffled, sometimes clear. If muscle relaxants are used, patients may be conscious but completely paralyzed, unable to move or speak. This helplessness is often the most traumatic part. In rare cases, patients feel pain, pressure, pulling, or even sharp incisions while trapped in their bodies. This combination can lead to lasting psychological trauma, including PTSD and fear of hospitals. Even without pain, the memory can haunt patients, causing anxiety and doubt. Validating these experiences is crucial for healing. Understanding the sensations underscores why prevention is so important. Preventing awareness during surgery is a top priority in modern anesthesia. It's something we take incredibly seriously. For anesthetists, we are dedicated to ensuring your comfort and safety throughout the entire procedure. It starts with a thorough pre-op assessment. This is a crucial step in tailoring your anesthesia to your specific needs. Your medical history, including any pre-existing conditions, is carefully reviewed. Medications you're currently taking, both prescription and over-the-counter, are important for us to know. And your lifestyle habits, such as smoking or alcohol consumption, all matter. These factors can influence how you respond to anesthesia. During surgery, your anesthetist stays by your side, constantly vigilant and attentive to your well-being. We are continuously monitoring your vital signs, including heart rate, blood pressure, and oxygen levels, and adjusting drugs as needed to maintain the appropriate level of anesthesia for the duration of the procedure. Sudden changes in heart rate or blood pressure can be indicators that the anesthesia needs adjustment. These changes can signal light anesthesia, meaning you might be becoming more aware. This prompts immediate action from the anesthesia team to deepen the level of sedation and ensure your continued comfort. Advanced tools like brain monitors, which measure brain activity, add an extra layer of safety and vigilance, particularly for high-risk cases or patients with specific concerns. If you're feeling anxious or have any specific fears about awareness, talk to your anesthetist before the surgery. They can explain your anesthesia plan in detail and address any concerns you might have, providing reassurance and peace of mind. Remember, awareness under anesthesia is extremely rare, thanks to the rigorous protocols and advanced monitoring techniques we employ. The comprehensive systems in place, from preoperative assessment to intraoperative monitoring, rigorous training of our anesthesia professionals, constant monitoring of your vital signs, and the use of advanced technology, all contribute to your safety, are all meticulously designed to keep you safe and comfortable throughout your surgical experience. Trust your medical team. They are dedicated to your well-being, but always feel empowered to ask questions and voice any concerns if you're worried. If you found this helpful and informative, subscribe to our channel for more insights into the fascinating world of medicine and anesthesia.